during the town hall. If we can't answer all the questions tonight, we will follow up after the event. All participants will be able to see comments in the chat feature. If you have a personal issue or problem you're trying to get resolved, place your first name and contact information in the chat feature, and a veteran service officer will reach out to you. Please refrain from posting personal information in the chat feature. Today, we will discuss ways that everyone can contribute to a safer environment for veterans at risk for suicide. We understand that this is a sensitive topic and that people in attendance today may have personal experiences involving suicide. If you find you need to take a break, please do so. Feel free to reach out at the end of the presentation if you need support. If you need to talk to someone at any time, you can call the National Suicide Prevention Lifeline at 1-800-273-8255. Service members and veterans should press 1 to connect with a Veterans Crisis Line. We also have 2 suicide prevention professionals from the Lebanon VA Medical Center joining us tonight. Erica Trotter, who is the Community Engagement and Partnership Coordinator for Suicide Prevention at the Lebanon VA Medical Center. And John Lucas, who is the Suicide Prevention Coordinator at the Lebanon VA Medical Center. We will have 4 poll questions throughout the evening. Please feel free to participate in the polls. There will also be a quick survey at the end of the session. We ask that you participate in that as well. We have 2 speakers tonight. Our first speaker is Brigadier General Pennsylvania, Maureen H. Weigl, the Deputy Adjutant General for Veterans Affairs. General Weigl oversees all aspects of the veterans aspect of the Department of Military and Veterans Affairs, and also our 6 state-run veteran home. General Weigl, the floor is yours.
Thank you, and thank you everybody for joining. This is such an important topic, and it is critical that we have these discussions. So I encourage all of you to text us, blog, and reach out and give us your thoughts and feedback. This is our first town hall, but this topic of veteran suicide is very important and near and dear to my heart. As you know, you've heard anywhere from 17 to 20 veterans commit suicide a day. Sometimes our numbers go up, sometimes it's down, but that number is staggering, far too high. We need to address this issue. And I will tell you, I have been looking at this topic since 2010 when I ran all of the soldier family support programs for the National Guard Bureau for all 54 states and territories. The National Guard had the highest suicide rates than any other component. Half of the folks that committed suicide deployed, half of them did not. Our data points to figure out what would trigger their emotions were all over the map. Finances, relationships, unemployment, opioid addictions, so many different variables. We did not have enough data points to figure out what really triggers it. And then I will say, I commuted to DC for 10 years, and I used to stay with my one cousin. And I will just tell you this personal story because it's very relevant to the topic. He had 2 young kids and a beautiful wife, and his wife became ill with colon cancer at age 40 and passed away. Within 3 months, my cousin, who struggled with depression for most of his adult life, tried to take his life by overdosing. And my aunt found him. And 3 months later, she and the kids were somewhere. He had a doctor's appointment. He's with a psychologist. He was on medication. I was with him. He and I were out the night before for dinner. Then he was telling me that he was in a dark place and he wasn't feeling well. And I try to tell him how great his life is and how wonderful he is and how amazing he is. And the very next morning, he and I woke up. We packed up the house because he was going to go to the beach and visit his kids. We put everything away. I locked it up. We both left. He went to his psychiatrist, and then he was going to drive to the beach. I received a call at 5 p.m. that he wasn't at the beach. Where is he? Have I heard from him? I went back to the house and I walked in and the door was unlocked and I found medicine and alcohol everywhere and all of his documents. And I realized he was here. So I had to walk through the house and I had to open every door. I had to look under every bed. I had to open every closet door. I knew I was going to find him. I didn't know where I was going to find him, and I didn't know what state I was going to find him. I had to walk around the entire house looking for him. And I finally found him outside in the shed that he had locked up. So I had to break into the shed, and thankfully I was able to get there, and he was sitting on the floor. He collapsed with the noose around his neck, so he wasn't able to carry out hanging himself. And I know this probably wasn't the right thing, but I slapped him in the face to see if he was still breathing. And I don't recommend that to anybody, but he did breathe and he gasped. So I dragged him out into the fresh air, brought him inside, called 911, and it was the worst experience of my life. When the 911 operators arrive and the police show up, they treat you like it's a crime scene. And you want to take care of your loved one and say he needs help. And they've already known him because they've been at the house before. And they immediately started questioning me, and they went through the house and we found every drug and everything that he could have taken, probably half of his wife's cancer medicine. And we put it all in a bag so they can take him to the hospital. I begged for me to go to the hospital with him, and they finally let me go, and they left the house there and they finished their investigation knowing he was already someone who tried to commit suicide. They asked where the kids were and where my aunt was, and I told them. So I get to the hospital, and my cousin is a doctor, and she was at the hospital, and she met me, and we met, and then he coded after we just told his aunt, my aunt, that her son was fine and that he's in the hospital and he's going to be okay. And he coded. And the next morning, when I talked to her again afterwards, and I said, "Don't come tonight from New Jersey." I was like, I will be with him. I'll stay all night next to him and I'll wait. When they put him on a ventilator and put him in a heavy sedation to help him and to get his oxygen levels back, the next morning he woke up and they came in and they said they were going to take his tube out. And the first question he asked me was, "How did you find me?" And the paramedics and the firemen and the police told me, "Maureen, this is his second attempt. He wants to kill himself. He's going to do this again. You just have to know." And I was like, "Why would you tell me that? There's things we can do for him." And they're like, "Not if he wants it this bad. He's going to do this." And that just devastated me. But when I look back at his notes to read the paperwork he left, he self-loathed. I mean, he hated himself. All of his notes with his psychologist and everything he wrote down about himself from that last meeting was how much he hated his life. And I messed up. I finally went to this assist training, and the military offers it, Department of Defense offers it for commanders and for first responders and for chaplains. And you go in and they teach you about suicide prevention and when people are in the position my cousin was in. And I did everything wrong. The night before, he wanted to tell me that he was in a dark place, and I took over the conversation and told him how wonderful he was. As you can tell right now, I like to talk. And I just kept telling him how great his life was, and his kids love him and his family loves him and he has so much support. So I'm thinking he's totally not one of those statistics. He has a whole family unit. We all love him. His mother's going to be here. Like, we're all here for him. Everybody's helping him. And I kept reminding him of that, but he couldn't see it. And still the next morning he tried to take his life. We were able to get him help for about 3 years. Sadly, he just never got over that. And I never realized the depths of lowness that people can feel in their lives, even when they have beautiful family and beautiful children and a mother who adores them, who is there. And the night he actually took his life, his mother was at his house. She knew something was wrong. I trained her to ask him in the morning, When you go to assist training, they tell you, don't be afraid to ask them, are you thinking of killing yourself? Are you thinking of committing suicide? Not, are you going to harm yourself? Because they don't think this is harming yourself. They think it's saving themselves and saving all of those around them that they love. It's a very rational decision for them to make. And he took his life, and his children were only 8 and 11 at that time. The first time they were 9 and 6. And it was devastating. And we were at a loss. And I saw what it did to his family. It wrecked their family. His siblings couldn't understand it. They did everything for him. And it's such a close family unit. It's not a dysfunctional family. So how could this possibly have happened to someone as amazing as he was? He was successful. His wife was a lawyer, worked for Department of Justice. He was an engineer, and he was making great money, went to Villanova. He had everything. And you think, that's not your stereotype of someone who wants to commit suicide. But then I've read every 15-6 investigation of service members who committed suicide in the military. There were captains, lieutenant colonels, majors, privates, specialists, sergeants. There is no data point. All I can say is we need to not stigmatize and think that these are the people who want to commit suicide. We need to say, what is it that makes people catastrophize the issues in their lives, and how do we help them? And I mentioned assist training, and I'm going to go back to that. That class taught you how to really talk about suicide to people who are really going to take their lives. And you need to be very honest, and need to be very forthright, and you need to be very aggressive on the way you talk to these individuals. And you have to realize that you need to let them talk. And if they talk, they will share their stories, and they want to tell you what's going on. You need to ask them if they have a plan. You need to take away their plan. You need to ask them, are you planning on hanging yourself? Do you have rope in your house? Take the rope. Do you have a gun? Take the gun. See what you can do to help these people and to make sure we are disarming the environment. If you could save them 30 seconds, 30 minutes a day, it really does help. I learned so much. So I shared that story with you because I will never forget any of those moments. I will never forget what I've learned. I was working on suicide prevention for the National Guard, reading investigations, listening to Department of Defense come up with their policies. None of it matched how to care for my cousin. And it would not have helped him until I took the assist training, until I took a step back and realized it. And I'm sharing this with all of you because there's a lot of reasons why people take their lives. I've known people who were in binds and they were going to go to jail, and they impulsively shot themselves so they didn't have to go to jail and their family didn't lose out on benefits. My cousin had depression. He fought for it all of his life. Medical insurance and pharmacists were not going to cover the care he needed. So it was a rational decision. There are people who break up with their girlfriends or boyfriends and their lives are a mess, and they make an impulsive decision. Every time I will tell you, most people think it's a rational response. Sadly, we all know it is a long-term solution to a short-term problem that they just can't see. So I will just tell you, we need to do so much. And one thing I've realized from going through assist training and watching my aunt and watching other family members struggle in the military is when we're doing all of our efforts, we need to include families, because families need to know how to talk to them, need to know how to disarm them. They need to know how to prevent something from happening. They need to know when to intervene. So if we don't train families and we only get the service member and the veteran counseling for themselves, we're missing the next piece. My aunt kept my cousin alive for 3 years because she was there. I taught her about assist. She asked the questions. She monitored. It's something we need to do. We need to continue to partner. Obviously, there are so many wonderful nonprofit and non-government entities in every community where service members and veterans can go if they don't trust the government and the VA to get the care they need. Females who have military sexual trauma, Vietnam era veterans do not always um, want to go to federal or government entities for help. They don't trust the system. The system failed them to begin with and put them in the position they are. So we need to continue to partner and build partnerships and encourage people to go. Um, Going to a counselor is like going to a fitness instructor. People will say, what's the best exercise I need to do to help me lose weight? And the answer is the one that you like, that you will do. And the same thing is for counselors. Some people like going to a chaplain. Some people want to go and talk to a priest. Some people want to talk to a psychologist. Some people want to talk to a friend. Whatever avenue they can go to get the help is what we need to encourage, and we need to grow access to that. And we need to make sure that mental health is not stigmatized. And although we say that suicide isn't stigmatized, and we're very encouraged by the number of people going and having ideations and seeking help, the truth is, if you have a heart attack and you find out you are on, you have high cholesterol, or you have different issues with your heart, we'll prescribe medicine, and you can go to your doctor, and the insurance companies will pay for all your treatment, and they will pay for your medicine. If you have mental health issues, they will limit the amount of appointments you can get for psychiatric care and for prescription drugs to help you. That does not destigmatize it. That still stigmatizes the disease. Mental health is just as serious as cardiac and heart issues, and we need to recognize those. When someone puts their hands on their neck to show that there's a sign of choking, everyone recognizes that in a restaurant, and someone will come up and give someone the Heimlich maneuver. We don't have something in place to recognize and to let people show when they are having a mental health issue and a stressor that is causing them to think about killing themselves. And we need to figure that out. We need to find a way for there to be signs when someone is struggling, and come up with a sign to let people know they're struggling. There's so many initiatives we're doing into the Commonwealth of Pennsylvania across agencies with Department of Health, Department of Human Services, so many sister agencies, as well as the VA and medical professionals in the Commonwealth of Pennsylvania. And so I know I have talked way too long. I'm very interested in your questions, but I'm going to pass it over now to Rick Hamp, who leads our department's Governor's Challenge and the state's Governor's Challenge, and is a subject matter expert in this topic. And so, Rick, I'm going to pass it over to you, and thank you so much.
Okay, well, thank you, ma'am. Thank you for sharing your story. That's amazing. Personal stories like that are touching. They bring a lot of issues to the forefront of the topic that we are going to be discussing this evening. And I'm hoping that we can get into some details a little bit more and talk specifically about some of the things that you brought up. The right, the wrong. There are many issues that we need to think about here, and a lot of different ways that we can approach how we look at suicide prevention. So, here in the Commonwealth, as you mentioned, we have a great partnership with our sister departments and agencies. We work with the Department of Human Services, the Department of Health, the Department of Drug and Alcohol Prevention, the Governor's Council on Gun Violence, and of course, the VA SAMHSA Governor's Challenge to prevent suicide. among our service members, veterans, and their families. There are some amazing efforts that have been going on here in the last 5 to 7 years, as we've really started to focus on service members, veterans, and their families in our suicide prevention efforts. The latest suicide prevention plan that was published here in the Commonwealth absolutely has our veterans listed as a specialty population. We fought long and hard for that. We wanted to make certain that we addressed the issue of suicide ideation and, of course, suicide attempts within this specialty population. And that includes the family members of our service members and our veterans. They serve too, and oftentimes they bear a heavy burden, just like our service members and our veterans do, but they stand there beside us, and they serve too, and they suffer through some of these very same things. So it's amazing to be able to be here with you. I thank each and every one of you for being here with us this evening. I hope that we can prompt you to ask some questions if there are concerns. This is a safe space. As Chip said before, we've got Erica Trotter and other folks from the Lebanon VA on, our CEPCs that are here. If anybody feels the need, please let us know either in the chat or raise your hand. We can get you connected to somebody that can help you immediately. This is a very sensitive topic, but it's a topic, as the general said, that we need to talk about. We need to be open, and we absolutely need to reduce the stigma that people have when they think about suicide and suicide ideation. This is something that I assure you, if I can get you to talk to me for 1 minute, if you're having an ideation, I can change your mind. It's a proven fact that by talking and by redirecting your attention for a very short period of time, we can prevent a suicide, and that's amazing. Caring is what this is all about. And while the general story, her personal story, ended tragically, I will tell you that the science shows that more than 90% of the people who have attempted suicide and survive never go on to die by suicide in the future. Again, that's a statistic that's out there, proven by science, but it's not absolute. So there are those cases where it does happen. General Weigl's story, her personal story, her story as a suicide survivor, it's important for us to understand, and she talked about it. The incidence of suicide can affect anybody, anywhere. There is no set demographic. There's no prototype of a human that is more prone to suicide than another, and there's no single cause. Suicide tends to be a over time accommodation, if you will, accumulation of things that cause a person to begin to consider harming themselves or to take their own lives. So I'll kind of leave it there, because I really do want to get into some questions. I'd like to see, if there's anything that we can bring out for you or talk about. If there are questions or information that you're looking for, I'd like to give you all a chance to do that. So I'll turn this back over to Jennifer and Chip, and allow them to kind of facilitate and take a look in the chat box and see what, if anything, we might be able to talk a little more about this evening. Chip?
Okay, very good. Thanks, Rick. We appreciate the comments. And we have one comment in the chat already from Mr. Holman. And I would ask that one of our mental health professionals from the Lebanon VA kind of take that one, if they would, please.
So this is John Lucas from the Lebanon VA Medical Center. How are you doing, everyone? Some great questions, and thank you for the presentations already. I'd just like to say the first question is suicide a form of anger turned inward? I know a large majority of some of the veterans that I work with often it's not necessarily anger towards inward, and this isn't for everyone, but it's more of often a sense of lost control. And with suicide prevention or suicidal ideations, in terms of I see people who are, either struggling with substances or struggling from previous trauma or, dealing with family concerns or, something that they don't have form of control in. However, we do have control over our own life. And often it is even, used as a form of coping mechanism that often ruminates, and that seems to be just at least I've been in this program for 5 years, and it seems to be kind of an ongoing. Things are always different in terms of from vary by case. So to answer that question, it's kind of where I'm going to leave that one with anger turned inward. Let's see the next one. Even a trained mental health professionals may take their own lives. Anyone may be vulnerable to episodes of deep depression. I understand that symptoms related to stress can be mitigated by effective social support systems. How can we strengthen mutual human respect and empathy so that everyone has an effective social support system? I think one of the things here at VA that we are also trying to encourage is when you talk about social support systems, we have different programs such as peer support specialists. We also have whole health. We have programs such as that run group classes that we try to kind of implement or try and have more of create more of a social support system. It's often hard, especially with people who are live in our areas or communities that are often shut off to public transportation or places where they may feel isolated. And often when people are struggling with depression, they tend to isolate. So it's kind of, even if they may have that social support system, they with in terms of being depressed, you may not reach out to that. And
Well, if I
sorry,
could
go
add
ahead.
one piece there on that note, John, you're exactly right. So, there are many different signs that we can look for when we see somebody struggling emotionally, either from depression or any of the other things that John spoke about. And that's when we can start to put mutual human respect and empathy into play by drawing that person out, engage them, get them to talk about what's bothering them. Don't be afraid to ask the question, as the general said, are you thinking about killing yourself? There are signs that we can see. So a person that is normally outgoing who suddenly is withdrawn and not engaging with family or friends, that's a sign, and that's the time to ask the question, right? It's okay to ask, are you okay? And it's okay for that person to say, no, I'm not. Then the rest of us need to be ready to help when you get that kind of an answer. Sorry, John, go ahead.
Oh, that's okay. And I also that there are some excellent points as well too. And a lot of times, we have a training that we use at the VA that's similar to the assist training. It's called SAVE. So recognizing the symptoms, and then basically validating the veterans and expediting getting help, kind of, and looking for the signs and symptoms. But essentially, too, I want to talk about how when you ask someone if they're thinking of harming themselves or ending their life, it allows people to open up about their feelings. And also, when we're able to kind of expedite and get people to help, we can help give them specific tools that they can go, such as developing a safety plan, or often getting resources, or getting things into play for that person, and having those tools available, so that way they can go to their toolbox when they do have those fleeting thoughts of wanting to harm themselves. Because quite frankly, I've worked with people who have suicidal ideations for the greater part of their life. And you know, it's about, you know, when you get those ideations, where are you going with them? You know, what kind of support systems, what kind of tools do you have in your toolbox? What can you do on your own without contacting anyone else? And if those things don't work, you know, what are the next steps that you can help to take, you know, keep yourself safe?
Yeah, amazing, amazing, John. So Jack, what was your question about the VAMCs? I see you said you had a question there, but not seeing exactly what it was. So if you want to develop that a little bit, put it in the chat box. We'll be happy to jump on that one next. And Alicia, your comments there about mental health first aid training, absolutely a great resource. Here in the department, about 3 years ago, we sponsored a lot of mental health first aid training throughout the Commonwealth. It's a great course. It's a great way to help people become aware of suicide ideations and how to react. But more importantly, it's a great way for folks to be empathetic with each other, to show that human respect, and to help identify challenges. Expand on that just a little bit to the question, persuade, refer, or QPR training and assist training that the general talked about. I will tell you that the VA medical centers all run these trainings, as do some of our not-for-profit and even our for-profit partners here in the Commonwealth. So Prevent Suicide PA and the Pennsylvania Suicide Prevention Alliance all provide these trainings, and they're happy to connect with you if you're interested in sponsoring a training session. They can get with you. They'll set up a course. They'll bring everything that's needed to run that course to you, and they're just consummate professionals. I trust them. The training that they do is excellent, and they're very active throughout the Commonwealth. So Tina Clymer, I hope that helps with your question about in Carbon County, Monroe and Pike counties, how can you get some help there? And if you need contact information for any of those organizations, just reach back to either myself or Chip or Joel or our regional program outreach coordinator, and we'll get you connected with those organizations.
Okay, thanks, Rick. Thanks, John. So now we're going to do our first of our poll questions. Do you bear with us just a sec? Okay, please complete the sentence. The rate of veteran suicide in Pennsylvania is A, lower than the national average of 31.6 per 100,000, or higher than the national average of 31.6 per 100,000. We'll give this about a minute and then we'll give you the answer.
So Chip, while they're answering that question, I just want to add a little bit of comment on this topic. So folks, suicide rates are actually decreasing for some demographics throughout the nation and even here in the Commonwealth. But unfortunately, they're increasing for other demographics. We're experiencing higher suicide rates in minorities, Hispanic and Black communities, and young children, believe it or not. Children under the age of 12 committing suicide, that's just crazy. And it is an absolute tragedy, but we're seeing that. So here in the Commonwealth, that's one of the things that I'd like each one of you to understand and to remember, that while there are some demographics that are actually reducing suicide, we are still experiencing extremely high rates in some of those other categories.
Okay, the results are in, and the majority of you folks chose answer B, which is actually correct. The PA rate is 33 per 100,000, and the national average is 31.6 per 100,000. So very good. We got a very smart audience here tonight.
Go. So Chip, yeah, Pennsylvania is an anomaly. We are higher than the national average, and we have a couple of communities here in the Commonwealth that actually stand out even higher than that 33% rate. So we're focusing in those areas and doing an awful lot of work. You've probably heard about the Together with Veterans program, which is a grassroots suicide prevention program sponsored by the VA. We're working with Vision 4 here in the Commonwealth. We have Together with Veteran programs in Carbon County. Oh my gosh, I forgot the other county. I'm so sorry. There's another county that's active though. It's Cambria County, I'm sorry. And then there are a couple of other counties that are working to get involved with a Together with Veterans program. Very, very valuable. We also won a grant last year to do a Northwest Pennsylvania suicide prevention program in cooperation with the University of Pittsburgh and their program evaluation and research unit. And this is a cooperative agreement with the CDC. So that's a 5-year program that we're working on. We're really looking to make a difference in Northwest PA. And then hopefully we'll be able to take everything that we learned from there, all those best practices, and we'll be able to export those not only throughout the Commonwealth, but through our sister states and territories as well. So this VA SAMHSA Challenge is a national, it's a national event, it's a national effort, and Pennsylvania is making a difference by providing a lot of information and a lot of best practices that we're exporting to those other states.
Rick, this is Jennifer. I just wanted to go back to Mr. Hartman's question about the VA Medical Center. He put in the chat, how can we have the VA Medical Centers utilize VCCN in less time? I have a vet that was stuck in ER while in active addiction. He asked for residential and hospital, could not reach the VA Medical Center. The vet only has VA medical health care. This was a huge problem, and the ER was ready to send him home. He needs immediate options, in my opinion.
Erica, I know you're on there. Do you want to take that one, or you want me to answer it?
Sure. Hi, this is Erica Trotter. I can answer that. If there is someone in particular that you might be working with, you can send me an email outside of this meeting, and I can get you in contact with someone that can assist the veteran that you're working with directly and maybe better answer your question for you. I'll put my email into the chat box for you and my phone number.
And Erica, just a follow-up question that came in from another individual, Chris Grill, and in follow-up with that question was, how are we preparing civilian hospitals and behavioral health providers to care for the unique culture and issues faced by veterans?
Oh, that's a great one. So first of all, let me state that I don't think any of our clinicians, aside from immediate care, life-saving care, the emergency room is not the place where we want someone who is contemplating or has attempted suicide. We need to get them out of the emergency rooms. We need to get them into clinical care, and they need to be working with specialists who are trained in dealing with suicide attempts and suicide ideations. So again, aside from that immediate care to save life, getting them, as Erica said, out of those emergency rooms and into clinical care, such as we can get at our VA medical centers and even private care facilities. That's the key to success. Emergency rooms are woefully unprepared to deal with the aftercare or post-suicide attempt care that a suicide survivor needs.
Okay, just moving down on the list here. Dave Reagan asks, how much is the drug and alcohol addiction rates affecting these high suicide rates?
You know, there are a lot of causes that affect suicide, and drug and alcohol abuse is a major contributor. You know, alcohol is a depressant. So if you're depressed and you're drinking, you just kind of compounded your problem, right? Drugs, bad decisions, okay, and making one bad decision after another, and the next thing you know, You're sitting there thinking about, wow, suicide might be the answer. And it's never the answer. It doesn't fix anything. Another piece of trivia for you. It's estimated that every suicide affects, on average, 136 people. So that's everybody from the first responders to immediate family, to members in the community. But one suicide affects 136 people. That is a big impact on a community and on the lives of anybody that becomes a suicide survivor. So, you can say, well, suicide is a selfish choice. Perhaps, but people that are contemplating suicide often aren't thinking clearly either. So keeping a clear mind, staying away from drugs and alcohol, limiting access to a person. If you know you have a person who is depressed and you're trying to help them through a situation, try to keep them away from drugs and alcohol in particular, because they are depressants. How many times have you said in conversation, you've seen somebody that's struggling, and you say, I don't know how they deal with that. They're so strong. I couldn't do that. I couldn't handle the situation the way that person is. That's the person you should be going up and asking, are you okay? And offering them the opportunity to talk, offering them the opportunity to tell you if they are okay, and to be there to assist or to provide support when and where they need it. Those are the folks that we see every day, and in the course of a simple conversation, we hear those kinds of comments all the time. Those are the folks we need to reach out to.
Thanks, Rick. The next one I wanted to bring up from Sarah Garcia, talking about in Bedford County. I think this was a point to make, was we do not have anyone here in our county, especially ER, that are trained to deal with military and veterans.
And that was Bedford County, you said, right? So,
yes.
And I apologize. I don't know if Bedford County has a county suicide prevention task force or not. I could look it up here quickly, but most of our counties do, not all. But I would encourage you to look and see if Bedford County does have a suicide prevention task force, and if so, to get in touch with them, because there are resources out there that we can utilize in counties even where they don't have a suicide prevention task force. For instance, in July, right now you've got a 10-digit suicide prevention crisis line that you dial. In July, that's going to go to the 988 system. So it'll be like 911, but you'll do 988. And that will connect you directly to one of 13 call centers here in the Commonwealth. And just like the National Crisis Line, when the phone is answered, you can press 1 and you'll automatically be transferred to someone, if you're a service member or a veteran, to someone who is trained and experienced in dealing with service members and veterans who are having suicidal crisis. So that's going to make things a lot easier. But there are resources in your communities, and again, I would encourage you to get with your regional program outreach coordinator and the CEPCs from the VA medical centers. They can help you find those resources in your county and make sure that you have access to them.
It looks like we just did that between a CEPC and the RPOC right now.
Look at that. It works.
So yeah, from what Olivia shared in the chat, that they do have a newly formed suicide prevention task force, and just getting the contact information there for her to learn more about that.
Thank you, Olivia. That's amazing.
Yeah, we have another question from Sarah I'd like to address. If the soldier doesn't register at the courthouse, we do not know who we have. Mm-hmm. That's one of the struggles.
Well, wow, so you guys heard Chip when he introduced himself. He's the chief for our Division of Outreach and Reintegration. And I will tell you, he has one of the hardest jobs in the Commonwealth. We have over 800,000, well, nearly 800,000 veterans here in the Commonwealth, fourth largest veteran population in the nation. And finding our veterans and connecting with them in a meaningful way is probably the hardest challenge that we have. And there are a lot of reasons that we too can't find our veterans. Some of them don't want to make contact with the government. They don't trust the government. You've all heard the deal. Hi, I'm with the government. I'm here to help. You know, some of our veterans simply don't want our help. They don't want to be in contact. A lot of different reasons. They're worried that, you know, perhaps their rights are going to be infringed on in some way. You know, I can talk all day about limiting access to lethal means. There's a poll question coming up in a minute where I'll do that. But you know, if we can talk to our veterans, if we can make that connection, we can help. And the real challenge is not in how we find them, but how we stay connected to them. So veterans that register their DD 214 in the courthouse, you know, that's one way where we can identify a veteran and try to make contact. But there are so many other ways. You know, right now, PA Vet Connect is out there, a program that's being run through our Pyro division and through CHIP's outreach team. PA Vet Connect, connecting our service members, veterans, and their families with resources in the communities where they live. I would encourage everyone out there, if you're not sure if there's a resource that you need and you just don't know where to go, please pick up the phone, go online, find out who your regional program outreach coordinators are, make contact with them. I promise you, they have resources that they can refer you to, and they will do warm handoffs or hot referrals. They'll make the phone call for you. They will do a warm handoff if necessary. They'll take you to that resource. You know, there's so much out there in community, and this community-based outreach program is designed to help us help you get the resources and the assistance you need in the communities where you live. It's an amazing program, and it's working. It's working very well.
Okay, just going back up in the chat. I know I wanted to mention too, Jack shared Psych Armor is one of the programs that does help social workers understand the military and veteran community. Absolutely.
Yeah. Jennifer, I'll just expand on that one for a minute. So Psych Armor is, you can go to psycharmor.org. You can establish a free account, and there are a number of virtual trainings on there that you can take. Every 15 things a veteran wants you to know, 15 things a soldier wants you to know, community-based questions, community-based courses that help you understand military culture. You know, there's just a ton of information there. We always encourage folks to go to psycharmor.org and to look at those courses to help you understand what it is that some of our service members and veterans might be facing, what the culture is. There's even a course on terminology. Everybody knows we love acronyms. So, you know, there's even a little bit of a course there that'll help you decipher acronyms. And it's just an amazing place to go for some quick learning, and it's free. So, you know, one of the things I love about that place is it's free.
Before I go on, continuing to the chat, Chip, did you want me to put up the next poll question?
Yes, please.
Yeah, go ahead.
Okay, what is the most often used lethal method or means? We have firearm, poison, suffocation, or other. And we'll give them a minute here.
Okay, Chip, if I could, I'll just kind of talk through this a little bit while you're waiting for the results to come in.
Sure.
So lethal means covers a lot of things. That could be pills, ropes, knives, guns, cars, bridges. You know, there's no limit to the things that can be lethal or that can be used for someone to take their own life. And when we talk about limiting access to lethal means, we're really talking about individual safety planning. And that starts with recognizing that someone is having a challenge. They may be depressed. They're a little out of sorts. They're not acting like themselves. And eventually they could get to a place where they begin to contemplate taking their own life. So when we talk about limiting access to lethal means, some very simple things we can do. Use pill lock boxes. Keep those prescription medications locked up in a lockbox. Keep the different kinds of things around the house. If you notice somebody's not acting right, take action to talk about what's bothering folks. What are the challenges that they're facing? Again, I go back to, if we can get people to talk to us, we can divert attention and we can save a life. A minute's worth of talking can save a life. So don't ever forget that. And we're not always talking, the results are in there. So, and Chip, I'll steal your thunder. Firearms by far, and it's almost a 85% of suicides are committed with a firearm. And that's a sore topic. When I talk about limiting access to lethal means with firearms, it doesn't mean that we need to come and take your guns. What it means is safe and responsible gun ownership. Identifying that somebody in the household may be depressed, may be considering harming themselves. If there is a firearm in the house, that is probably going to be the tool of choice. Again, depending on demographics, age, sex, gender, those kinds of things. But by far, firearms are the lethal means that is most used. So one of the things I like to talk about is, safe storage. Keeping your weapons locked up in a safe, remove the firing pins, store ammunition separately, all those things that can help slow somebody down. Putting, there are appliques now that you can put on the hand grips of a firearm. Get an applique of a loved one, have that put on your firearm. When you pick that weapon up and you see a picture of your child or your wife, it may make you think just a second longer and lay that weapon back down or secure it so that it's not so readily accessible. But my favorite option is safe off-site storage. Most of us belong to a gun club or a range where they store firearms. The gun club that I belong to, no questions asked. If I walk in and ask to store a weapon there, they take my weapon, I sign it in, they store it in a vault. When I go back to get it, it's there. No questions asked again to take it back out. It's just routine. The only one that needs to know I put it in there for a reason is me. And that's probably one of the safest and most effective methods of limiting access to lethal means, safe off-site storage.
All right, well, according to the data we have for the answers, firearms is 48%, suffocation is 30%, poison is 14%, and other is 8%. There was one question in here that I would like to go back to. May take me a while, a couple minutes here to find it. If anybody else sees a question that it can answer, please jump in.
One question I'll ask to the panelists, Jack Hartman asked was, how do veterans find local organizations that support systems for veterans that could use more help? An example could be Camp Freedom or Marion Outdoor Association. What are your thoughts on expanding funding possibilities for those types of organizations to help veterans find support systems that teach skills?
Jack, that's a great question. So, Jennifer is one of our RPOCs, and Camp Freedom just happens to be in her area. So I'm sure she's very aware of what they do. There are some amazing opportunities out there. We support those types of organizations that are there as support mechanisms for our veterans. It's no secret that we use the Veterans Trust Fund to fund nonprofit organizations. One of the priority areas that we're looking at this year is suicide prevention. It has been a priority area for a while. So organizations that come in and request funding from us and they have a focus on suicide prevention or training, any of those kinds of things that help with preventing suicide or educating about suicide. They're going to receive a priority when it comes down to funding. So there are those kinds of things. I talked to you a little bit about some federal grants that we applied for and have won that focus on those same kinds of things. We have a number of organizations here in the Commonwealth that use outdoor activities, hunting, fishing, camping, hiking, as modalities to help our veterans, our service members and our veterans deal with and talk about some of the challenges that they're facing. Equine therapy, service dogs. We support all of those kinds of efforts, and we do as much as we can with our trust fund. General Weigl has been working diligently to try to increase donations to the trust fund so that we can fund more of our partners in community. This year, we'll be doing about $1 million in grants to these nonprofit organizations in an attempt to help support these kinds of efforts throughout the Commonwealth.
The next question I wanted to bring up, and this comes up a lot in the local suicide prevention task force I sit on too. Dave Reagan asks, I truly feel another large piece of this puzzle is working with law enforcement so that the LEOs can communicate better with our veterans and their families. They're the ones in the most cases on the true front lines of this battle. How can we get them more involved?
Okay,
That's the one I was looking for, Jennifer.
There you go. So about Chip, it was 5 years ago that we did the veterans designation on the PA driver's license, 5 or 6 years ago.
2014.
Okay, 2014. So one of the first things that we tried to do, and if you think back to 2014, we had a lot of our guardsmen were coming home, active duty members as well, from Iraq and Afghanistan, and they were having a lot of challenges with law enforcement. So one of the things that we did was we put the veterans designation on the Pennsylvania driver's license. And that amounts to the flag that's there. So if you're a veteran, you can get that flag put on your driver's license for free. And that's one of the very first indicators that law enforcement have that they're dealing with a veteran, okay? So that's a great first step, but it's not the end all be all. Most of our law enforcement agencies have been involved in a training called Crisis Intervention Training, CIT, where they are, part of that training involves identifying service members and veterans. They get a lot of culture training on how to approach a veteran, what a veteran or a service member may find to be threatening. They're taught how to de-escalate. There's just a ton of training that goes on in CIT training. and most law enforcement agencies are involved in that kind of training now. So there is a lot more awareness, and it's really an ongoing effort to make sure that as things change, as our modalities change, the way we work with each other, that we keep these folks updated and we keep them informed of the different things that we're doing. So it's all about communicating with our partners and making sure that we focus on the service members and veterans that we're treating.
One other comment I did want to bring up too, Senator Pat Stefano had mentioned some of you might have seen the change coming with the 1-800 number for suicide prevention is changing to 988. And so that is true, and that is coming soon. I don't know if anybody else on the panelists wanted to speak more to that point on the change. Pete Albert, maybe.
Yeah, hi, this is Pete Albert. I'm the Visit 4 Suicide Prevention Program Manager and work closely with Rick and many of the people on the call. I just put a link in the chat to some more information on 988. And I just wanted to assure everyone that the Veteran Crisis Line is not going away. And we anticipate in VA that it's going to be around for maybe up to 10 years or more. As we get more accustomed to using 988. But it's certainly going to be a great resource because most of us know when we have an auto accident or a fire or medical emergency, we call 911. Well, 988 is just going to be our counterpart for anyone who may be at risk or need that further assistance. So just click that link and you can learn a lot more about it. But thank you. This is a very good conversation I'm hearing today.
Well, thank you, Pete. We're running down through the comments here to see if we can, looks like everybody's questions are pretty well getting answered one way or another, which is a good thing. So Jennifer, why don't we go to the next poll question, please? Okay, limiting access to lethal means causes a what % in harm reduction? Everybody's been pretty much on track with the questions tonight, so we'll see how this one goes. All right, poll time is over. We'll get the results here. And thanks to everybody for participating in the poll questions tonight. So once again, the crowd is pretty much on track. The answer is, in fact, 90%. So very good.
Chip, that brings up another little bit of a side topic that we can talk about, and that is how can we act to prevent suicide? Okay, so there are a lot of different things that we can do, but in community, strengthening economic supports, simply by improving financial security and housing, those necessities of life, supporting people, making sure that we're strengthening those economic supports is a big protective factor. Facilitating access to and delivery of suicide care. Again, by using the VA, by finding those resources in community, allowing us to help you find those, we can get you to and deliver the care that's necessary. It's amazing. It's scientific fact that veterans who are in VA care and seek care at the VA, they are less likely to commit suicide or to even attempt suicide. We have to create these protective environments, which means we reduce access to lethal means, reduce stigma, reduce the excessive use of alcohol and other illegal substances, and you've got to combat those substance use disorders. Protective environments are so important, and that can be as simple as a hug, an encouraging word. A protective environment starts with care. Promoting connectedness. This is something that Joel and his team have been working on, along with Vision 4 and the CEPCs. And that's nothing more than once we make contact with a veteran, we provide some sort of assistance or advice or a connection. Give it a day or two, a week maybe, and just reach back to that person and ask how they're doing. It's say, hey, it's been a week. Hope the connection went well. Is there anything else I can do for you? It really just helps to let the person know that they're not alone, that somebody does care. And it gives them an opportunity to reach back for any assistance that they might need in the future. Teaching coping and problem solving skills. What a big difference this can make. There are so many ways to deal with stress and depression. And it's unlimited, the things that we can do. But we have to help teach those coping and problem solving skills. And identifying and supporting people at risk. Again, that is a big deal. That is one of the major challenges in the VA SAMHSA Governor's Challenge. Identify our service members, veterans, and their families, and then screen for risk. You've got to know how to do it. It's important that we do it right. Not everybody that we come in contact is at risk. So being, the ability to identify those at risk is so important, and then taking the correct action after you identify that somebody is at risk. And of course, we need to lessen harm and prevent future risk. This is all the postvention, self-reporting messaging that we're doing throughout the Commonwealth, not only in the Governor's Challenge team, but in our state suicide prevention plan, and other activities that we're doing with sister departments and agencies. So important, making sure that people understand There does not need to be stigma attached to this topic. We should be able to talk openly. Where people are here to help, people care, and reaching out and taking care of building those protective factors is so important. Pete, is there anything you want to add to that piece?
Sorry, I was just trying to find my mute button. Yeah, that's the one thing. It's like suicide is kind of like, that onion. There's so many different layers to it. Events may be similar between two different people or two different veterans, but there's so many variables out there. So, one thing, just to kind of build off of what Rick was talking about is, never being afraid to ask, to ask those questions. If you're able to do one of the gatekeeper trainings that's been talked about, whether it's VA Save or QPR or Assist or Talk Saves Lives that is offered by the American Foundation for Suicide Prevention, all of those things are excellent. I mean, you don't need to be a trained mental health professional to save someone's life. And you just really don't know, that little outreach you do, as you're going out to get your mail, maybe you're talking to your neighbor or you run into someone, at church or out in the community. Just that little outreach you make to them can make a huge difference, when we're talking about suicide prevention.
Hey, Pete, while you found that mute button, that last
Yes, sir.
question in the chat there. That's
access to care. Yeah, I'm going to go ahead and I'm going to put in the link a resource locator that you can use across all of VA. And you can go to that link and you can put in your zip code or your town, and especially it's better with your zip code. But then you can click there and you can get to all the VA resources, and you can set like a parameter regarding mileage. And things like that. But I'm going to put that in the chat too. And I also saw someone was looking for a list of different suicide prevention task forces, that exist. And just one of the resources I'm aware of that I'm also going to put in the chat is the preventsuicidepa.org website. And they have a link there where you can go under resources, and they have a listing. This is not the only resource of that kind in PA, but that's the one that I'm the most familiar with. So I'm going to put that in the chat too. I haven't really been looking at the chat, Rick. Was there anything else you thought? Oh, I think, yeah, I see somebody did put suicide prevent PA in there. That's great.
Hi, this is John from Lebanon VA Medical Center. I also wanted to comment, just to kind of piggyback on the lethal means restriction. One thing, if you were able to get in contact with your suicide prevention coordinators at your local facilities, we do have access and resources available to get communities and also nonprofits and access to gun locks. So we do work with other local nonprofits here that we're able to help provide gun locks to. And they also, which is nice, is they have the Veterans Crisis Line information on them, along with a VCL, a wallet card. So I strongly encourage people, if they're interested in getting access to gun locks, to reach out to your local suicide prevention coordinator.
Yes, I know for the outreach team here, the VA has done a remarkable job at providing us with gun locks at our outreach events, and a lot of veterans have taken those gun locks. So we appreciate you guys providing those to us, and we're hoping that they're going to good use. Okay, Jen, how about let's do the final polling question, please. And once again, the audience is right on the money. The answer is false. Less than half of military U.S. population had a mental health diagnosis at the time of death. So a very good job on the polling question tonight, folks. There was one question that I wanted to address. Somebody had asked if we support the wounded warriors. I'm not sure if they're speaking about the national organization, but I know that here in Pennsylvania, we have the Pennsylvania Wounded Warriors, and we refer people to them, and we work in partnership with them quite a bit. They're an excellent organization, and they really help a lot of veterans. So if you can, you know, donate to the Pennsylvania Wounded Warriors, that I can guarantee you your money will be going to good causes and helping veterans and soldiers and family members. Do we see any other questions that we need to get answered, Jen?
None that I can see, no. Everybody's been doing a great job answering them in the chat too. So there's some great links there that have been provided too. Like I said, this is being recorded, so too, I know there's a lot of information shared that this can go out for the attendees, so you have this information.
So Chip, if I could just do a real quick closing here, final statement from me. I'm so impressed with the folks that have joined us here this evening. You know, I've seen some of our nonprofit partners out there. You know, Whip Shelter is on from the Dog Tag Club. You know, so many different people that are veteran advocates. Our regional program outreach coordinators are here, the CEPCs, Vision for Suicide Prevention folks. Pete Albert, thank you so much for jumping in, sir. We do appreciate your support. You know, folks, there is such an overflowing abundance of help that we can provide. And I can promise you, every one of those folks that I mentioned are here and ready, willing, and able to help. We're here to support each other. Empathy starts with us. And, you know, we need to continue to spread this message. We need to talk with each other. We need to talk with our brothers and sisters out there in community. We need to make sure that everybody understands there is help. They are not alone, and we're here to stand shoulder to shoulder with them in their time of need. If we can all just share that message, we can save some lives. And I thank you all for your time and for being here this evening. Please go out there, do great things. Ask somebody if they're okay. It's all right to ask that question.
Well, thanks for your closing remarks, Rick. I have also put my contact information in the chat block, and I'll send that out to everybody. And please, if you're wanting some information, or you know, looking to possibly get into the programs that offer suicide type initiatives, give us a call. I'm sure Rick can hook you up for one, and but we can certainly point you in the right direction. Our regional program outreach coordinators are very connected in the communities. So take a look at those regions where they're at. If you would like to get in contact with one of those, please let us know and we'll get you in contact with one of them. They're great resources throughout the Commonwealth, and they're very connected within their specific regions. So reach out to us, and we will do our due diligence to assist you. So, well, ladies and gentlemen, our time is up tonight. Thank you for all participating in tonight's event. We really appreciate it. Very good turnout, very good discussion, and a lot of good support that we got from the federal VA tonight and some other entities throughout the state, nonprofits and stuff. So I really appreciate that. If your question was not answered, allow us a day or two to respond to your question, and we will do our due diligence to respond to you. So great event. Thanks very much for joining. Everybody have a very good evening. Thank you all.